I'm ready. Hi, I'm Michelle and I'm one of the hospital nurses. I'm here to talk to you about your recent diagnosis of DVT, or deep vein thrombosis, and to go over your hospital to home transition kit for your medication Eliquis. I know that things seem to be overwhelming right now and there's a lot to understand. So I wanted to break this down a little bit and go over a couple of the basic things within the kit. I also ask, as you go along and you navigate through all of this information in this kit, that you write down questions or concerns or even words that you may not understand, so that at your next visit we can go over those with you. So as you open your kit, the first thing I'd like to go over with you is your Getting Started guide. This is a pretty big book with a lot of information, so I just wanted to give you some of the more important pieces of information. As your doctor may have already explained to you, a DVT is a clot, a blood clot that is in your leg. The main concern with a deep vein thrombosis is that it can travel to your lung and become a clot in the lung, which is called a pulmonary embolism, or a PE. So it is very important to treat a DVT and make sure that we follow up with you accordingly. On this page, it'll go over what a DVT is, and you can probably remember what brought you to the emergency room in the first place. You had some swelling and some redness and some pain. The nurses and the doctors took blood work and did an ultrasound and came back and told you that you had a blood clot. One of the things that's really important to talk about with having a recent diagnosis of a DVT is that there is a risk of reoccurrence within the first year of having a DVT. And if you look here, it is a 33% chance that people with a DVT or PE may have a reoccurrence within 10 years. That being said, it is important to treat your DVT appropriately and to obviously have follow-up with your physician. When you keep looking through this book, you will find some information which may seem overwhelming and confusing. These next pages are all the clinical trials. All that really means is that the company that released the medication did trials on patients who have already taken the medication and have given you the information on their outcomes. So pretty much what that means is they took information on several patients who already took the medication and are able to tell us how well they did with this treatment plan. Another page that I think is important to go over with you is how Eliquis, the medication you're taking every day, differs from other blood thinners. Most people know someone who's been on a blood thinner, and some of the common misconceptions are that all of them are the same. For example, you may have a friend who's on Coumadin and will tell you how frequently she has to go to the doctor to get her blood work checked. Or another person that may be on Lovenox, which is only an injectable medication. One of the other things that's really important is certain medications have dietary restrictions. So you may have heard friends saying, oh, you're on a blood thinner, which means you can't have any leafy greens. That is not the case with Eliquis. There are no dietary restrictions. It can also be taken with or without food, and it does not require any routine blood testing. That's your Getting Started guide. The next thing I'd like to go over are just some basic pieces of paper and information. One is, this is a 30-day free trial for you that you can take to the pharmacy, and it has a group and an ID number for you to get your first 30 days of treatment for free. After your first 30 days, there's also information in your packet to make sure that Eliquis is covered by your insurance. If you look on the inside, you'll notice this 1-800 number. You can call this number to work on your insurance and also obviously speak to your physician about that as well. Now, last but not least, the piece of paper that I feel is the most important in this kit is your starting Eliquis dosing guide. When you open this up, you'll see that it has all your dosing information, and it even has a calendar to remind you of how to take your medication. The thing about Eliquis is this: your first 7 days, you will be doing a starting dose. So you will be taking, as you can see, 2 5 milligram tablets in the morning and 2 5 milligram tablets in the evening. Each day when you take your 2 tablets, you can cross off a checkbox to keep track of your medications. Once you reach day 7, with the 2 tablets in the morning and the 2 tablets at night, you would move to step 2, which was your continuing dose. You'd take 1 tablet in the morning and 1 tablet at night. Now, if you decide with your doctor to do an extended therapy dose, which would start after your initial 6 months of treatment, you would then be brought into the extended therapy dose range, which would be 1 2.5 milligram tablet in the morning and 1 2.5 milligram tablet in the evening. On this flyer as well, it discusses a bunch of the safety information, and these are the things I want you to understand the most. The things we want to know from you while on your Eliquis treatment is if there's any unexpected bleeding that you cannot control, any bleeding that is severe, any red or brown urine or red stools, any coughing up blood, or any vomit that may look like it has blood in it. And of course, any unexpected pain, swelling, dizziness, or weakness. Any of these signs and symptoms, you call the physician immediately and the hospital. So, as you navigate this difficult diagnosis, please know that we are here to help you every step of the way. Eliquis is just the start of your treatment plan, and we will continue to watch and guide you every step of the way. Please remember, take your pad and paper, write down any concerns you may have or any questions, and we will see you shortly at our office to go over any of your concerns. Thank you.